This training video goes over the menu set of the meaningful use reporting calculation, and so we're going to start with this first line item, which is under the meaningful menu set of meaningful use. This would be the second video on the meaningful use, so I would advise you to watch the first one on core sets, so therefore you can see how we've come up with the denominator. The denominator that is showing basically shows how it shows that we have a patient on our appointment scheduler and we have checked them in. One thing I would just like to back up a little bit on, under medication orders, you did not have a denominator for checking the patient in. That denominator does not come until you have created a medication within the electronic prescribing module. So once you've created that and then sent it by fax, that's how you would get your numerator. So just a little additional information, which I probably should have gone over in the original video, but you should have watched that first. This would be your second video to watch. Okay, so patient-specific education. Use certified EHR technology to identify patient-specific education resources and provide those resources to the patient if appropriate. Okay, now if you see that this is only a 10% criteria, so you're not going to have to do this on every patient, just 10% of your patients, and you can note that you explained it to the patient. So when you're talking to the patient, and you can say you went over this information with the patient, and that would count. And so you would say you explained it. Now you can create custom templates that you can actually print and give to the patient if you would like, with information regarding the patient specific education. So I'm going to show you how we would go over that. I'm going to go ahead and click close on this. Now I'm going to go back to the patient's chart, and on the left we have patient instructions. So I'm going to click on patient instructions. I'm going to click give new. Now you can do this one of two ways. You can either do it through the note, or you can do it through here. So let's say the patient is smoking, and so while you're seeing the patient, you can give them quit smoking tips, like start chewing gum, or start having a pen in your hand to help control that temptation to have a cigarette in your hand, or different things like that. Or and so we could say we explain that, and how smoking affects your lungs, explain that as well, and smoking and cancer, we explain that. So went over several different things to to help deter the patient from smoking, and so we've noted that we explained it. Now if we wanted, we could print out custom information that we've created that gives them all the kind of quit smoking tips, and things of how it affects your lungs and how it can cause cancer and things like that. And so you could go on to say you printed the information out and gave it to the patient, which you can do that as well. But I'm just going to go over this on how you would have explained it to the patient during the visit and document it this way. So I'm going to go ahead and click on those, and then I'm going to click save. And you can see here now it comes up and gives you some pre-printed documents on quitting smoking tips and smoking in your lungs explained, and all of this information. So you can then print it, or you can you don't have to necessarily print it. It should calculate it. I'm going to go ahead and click print on this. Actually, I'm going to click close on this, so that way we can see if it does calculate just by explaining. But I think it should show that it explained. Now I'm going to look at given reports. So you can see here that yes, we explained it, but no, we didn't print it. Okay, so now let's go back and look at our meaningful use and see if it did calculate the way I expect it should. Okay, so we explained it. We have now a numerator of 1 showing we have 100%. All right. The next option is provide patients with timely electronic access to their health information, including lab results, problem list, medication allergies, within 4 business days of the information. And the way we do this is, let me show you, is we're going to go back to our patient's chart, and we're going to come down here to view demographics, and then we're going to edit or click on demographics and edit demographics. And so now I'm going to go to patient add info. The way you provide them access to the information that is required to give them access to is by providing them a username and password for the patient portal. So then we would give them a link to a website. They would be able to go in and access the patient portal, and then they would put in their username and password, and they would have access to all of their medical records, all of their all their prescriptions, all their x-rays, all their labs, you name it, everything. And they have the ability also to amend their medical record through the portal. They can also add, update their social history, their medication history, their health information, their insurance information, all of the information that the patient can go in and update all that information. And it is broken down to where we can see what is updated by the patient, what is updated by the staff. So you can see a history of this information being updated. So I'm going to go ahead and put in a username. We'll call it, we'll say TES, or just call it meaningful. And the password is test. Alright, and now I'm going to hit save and close on this. Alright, so now we're going to go back and look at the meaningful calculator and verify that it did update accordingly. Okay, so we took care of 3 of the options here. So we have a patient with timely electronic access to their information, and we have to give that to them within 4 business days of seeing the patient. Patient-specific education resources. Use certified EHR technology to identify patient-specific education resources. And we did that at the same time that we were doing this option up here. So it has addressed, we have now addressed all 3 of those options. Okay, the next area is lab test results. Incorporate clinical lab test results into the certified EHR technology as structured data. That structured data means that you are entering it through the lab module, not just free texting it in. It calculates it according to how you enter it. So we will go over that now. And so your denominator, you can see, is at 0. And so what happens is as you order tests, that creates your denominator. Then as you document the results, it creates your numerator, giving you your percentage. And they're wanting a minimum of 40% done this way. So 40% of your patients, they need you to, at a minimum, order your labs through the lab module, and then you can fax those out, and that is, I believe, part of the numerator is showing that you faxed it out. But we will look at that. Hold on just 1 second. Okay, so now we're going to go back into the patient's chart. I'm going to go to lab on the left. Now you can do this in more than one way. You can do it either as on the link over here, or right up here, so quick link here, or I know I saw it over here. I don't see it on the left, but I do see it on right here. So we're going to go ahead and click on Order Labs. And so I'm going to click on CBC. I'm going to go ahead and bring that over. And then I'm going to say I'm going to do the test in the office, or I'm going to print or fax it. So I'm going to go say I'm going to print or fax this order. And so now I'm going to click on Order Tests. Okay, now it's asking why are we ordering this. So now it's attaching for charge purposes, because typically if you're in an office setting and you have your own lab, when you send over for a CBC, in order for them to charge for it to the insurance company, you have to attach a diagnosis code as well. So it's asking what diagnosis code do you want to attach to this. I'm going to put the hypertension, and then add reason for the order test, and continue saving, close without adding. So you can also do it without adding that diagnosis code, but you can do it one of two ways. So you can add the reason or without the reason. So I'm going to go ahead and just add it. Alright, so now it's bringing up the lab order, and now I'm going to save and fax, or I can save and print. Either way, it is going to calculate it accordingly. I'm just going to hit save and fax, and then I'm going to send it to my fax machine as well. And I'm going to say no cover sheet on this time, because this is just for test purposes. Okay, now it's showing to be going out. Okay, now let's go back and look at our meaningful use and see where we stand on that. Okay, so it does not bring in the numerator for faxing it. It creates the denominator showing that we did order it through there. Now, in order for us to get the numerator, we have to enter the results of the test. Okay, so now we're going to go back and enter the results. Alright, so I'm going to go to my summary to add my results. Lab results. I'm going to click on lab results right here. Okay, in order to enter the lab results, I'm going to click over here on laboratory, and when I click on it, it is going to give me a drop down, and then I'm going to select enter results, and when I click enter results, then it shows the labs that I have ordered, and then it gives me an option to enter my results. For CBC, I don't think this is the best way to enter them. I am going to have to follow up with to give you the best option on this, because I know that there's multiple results that you're going to get back on a CBC. Okay, if you saw the little comment that popped up that said I needed to add what tests were included on this panel, right before I was talking about you can't really add just results just because it's got multiple things within the CBC, and so now it is asking for us to determine what we added. For instance, say albumin would be in the panel, alkaline phosphatase would be in the panel, ammonia would be in the panel, and so I've added those three to it. And so now, as you can see, it has now given me those options to be able to add the results. So my albumin 3.2, my alkaline phosphatase is 35, and my ammonia is 25. And then I hit save. And you can also click on normal as well. Just check the box normal, and it would just show that it is within the normal range. You're not going to document the exact number, but and it would show on the summary that these are normal. It wouldn't document the exact number that they were. So now let's go back and look at the meaningful use again. Alright, so our lab results have been updated to show the numerator. Okay, send reminders to the patient per patient preference for preventative and follow-up care. Okay, on this next menu set, I believe that is also going to be in an optional situation based on whether it is in a clinic setting or a nursing home setting, but I will go over it briefly, and then I will have to get back with you to confirm this information. It is on the CMS EHR in meaningful use document that I would have sent to everybody, so it would be something that you would want to review that section. I believe that is an optional area based on what kind of setting the patient is in. So in a clinic, this is how you would do it. Basically, you click on Health Maintenance Due, and then this is where you set up your criteria as far as what you want the patient, what should be ordered for the patient. For instance, a male over 50 may need to get a prostate exam. For a female, you may want yearly pap smears for a patient that has had cancer. I'm sorry. Breast, yes, or a breast exam for breast cancer yearly, or whatever the situation is. And so here you can set it up to do global, so for all your patients, something that is required for maybe for all females that you see, or for all males. And then you can also do like vitals due, and allow you to put when they're due and things like that, and what vaccines are due. You can add those in as well. And so here is where you would set your criteria for what would typically be due according to your medical knowledge of the patient and of your groupings of patients. And then once you have done this and set this up, then you would, let's say, still a little unfamiliar with this, so give me just a minute. This is probably something I will come back in as a second training on the last three sets of the menu, last three areas of the menu set. This is a little bit more in depth. This is something I don't really understand all that well because I don't do a lot of this clinic stuff. I'm going to pause this and come in with a second training session on the meaningful menu set criteria. Okay, thank you.